Well, October is upon us. Pink ribbons are appearing everywhere. Professional athletes will be wearing pink shoes, pink shirts, pink accessories, all in honor of Breast Cancer Awareness Month. According to the American Cancer Society, 1 in 8 women in the U.S. will be diagnosed with breast cancer. Mammograms have the ability to detect these cancers early. With October being Breast Cancer Awareness Month, I wanted to take this time to discuss with you the importance of mammograms, the myths, facts, I call excuses, why women are passing on them, and mammography guidelines, my personal experience regarding mammograms, and good news for those who fall into that 1 in 8 category. I'm an RN, and since 2008, my main focus has been breast cancer patients. I discuss with them their disease process, their education regarding the disease, and their treatment options. But we also do community outreach, and we're trying to capture those women who have been foregoing their screenings, mammograms, pap smears, things like that, due to economics. So mammograms are currently the gold standard and our only most accurate way for tracking and keeping progress on breast changes and breast disease. This is one thing you can do that's proactive to take charge of your health care. Breast cancer is the most common cancer among women and the second leading cause of death, second to lung cancer. According to the American Cancer Society, 1 in 8 women will be affected. Look around this room. It's a pretty scary statistic. So what is a mammogram? It's a specific x-ray that targets the breast tissues and looks for things that can't be felt during a clinical breast exam. It's the one tool we have in our arsenal for early detection of breast disease. Breast changes occur in all women, but they're all not cancerous. A lot of them are no cause for alarm. There are 2 kinds of mammograms. One is a screening mammogram, one is a diagnostic mammogram. A screening mammogram is where you go for your annual, yearly, and there's no problems, nothing special to look at. Diagnostic mammogram is where you do have an issue and we need to concentrate on that area. So why are mammograms so important? According to Dr. Marisa Weiss of breastcancer.org, annual mammograms starting at age 40 is the best way to catch the disease early and to improve the odds of beating it. Approximately 50% of small cancers have been caught by these mammograms. The death rate has decreased due to early detection. So, do mammograms cure cancer? No, we all know that. But we do know that mammograms catch these tumors early, and combined with medical advances and technology and increased awareness, it is a powerful tool. Okay, so being a woman is the one main risk for breast cancer. So it's a no-brainer. This is an easy decision, right? So why do so many women put off their mammograms? Here are some myths, facts regarding them. I call them excuses. There's 10 of them. I've compiled these. Number 1, nobody in my family has breast cancer. Well, it is true that if you do have breast cancer in your family, your chance of getting breast cancer is much higher. But 85% of the women who are diagnosed with breast cancer have no family history. Number 2, I'm too young to get a mammogram. Okay, the truth is, the most common cancers are in women 55 and over. But, unfortunately, in these women that are younger, it does happen. Number 3, radiation is too risky and it causes cancer itself. The truth is, the amount received is extremely low. And per the National Cancer Institute, it is so low. The guidelines for mammograms and mammography equipment is so stringent that it's so safe and we do use low-dose radiation. The risk is small, and compared to the expected reduction of diagnosis of late disease that is achieved through screening, it's still a no-brainer. Here's number 4. I'm afraid they'll find something. The truth is, 80% of our findings are negative. But wouldn't you rather have something that's found sooner when you can do something about it than later when you can't? Number 5, it's too expensive or I don't have insurance. The truth is, now mammograms are offered at low or no cost through the Cancer Detection Program, which is your Medi-Cal and things like that. And the Affordable Care Act has now provisions for your screening tests like your pap smears, mammograms, things like that. And also the National Cancer Institute has other options available. All you have to do is write them a little letter. Number 6, it's too painful. The truth is, it's a quick procedure. You can schedule your times during your cycle when you're not as uncomfortable. And also, if you tell the tech that is doing your mammogram, she can be a little bit more gentle. Number 7, I don't have any lumps. Terrific. Unfortunately, mammograms do detect those small tumors that you cannot feel on a clinical breast exam. Here's number 8, I'm too busy. Mammograms take approximately 15 minutes, 30 if you have breast implants. It's part of a routine health screening, so it makes more sense to have it done now and it'll be much more inconvenient or time-consuming if you do get diagnosed with a disease. Number 9, my breasts are dense. The truth is, mammograms are not as accurate with dense breast tissue, but they are not useless. We find calcifications and other subtleties that may signal you might need another test, MRI, ultrasound, but you need to discuss this with your physician. And here's number 10. I exercise, eat right, and I'm never sick. Again, I will say, terrific, but you got to keep it up. But that also doesn't eliminate the chance or the risk that you may get it in later life. I also want to be fair to those critics who are against mammograms. They say that the risks of the false positives and overdiagnosis is immense. Whether it means undergoing unnecessary procedures or facing unnecessary fears of being diagnosed. Just because a cancer may not kill you and they find it, does it make sense to leave it there and wait for it possibly to get bigger? Or it's a no-brainer also. Bottom line, I've heard a million excuses. So do not let this stop you from getting a mammogram. It could save your life. So when should you start getting mammograms? I prefer the American Cancer Society's recommendations. The goal of screening exams is for early breast cancer detection, and it's to find these breast cancers before they start to cause symptoms. So, yearly mammograms starting at age 40. Unless you have a family history, we like to start you at 35, and then you can continue just doing clinical breast exams unless you feel an issue. Try to continue with the same facility also, because we do need to compare those mammograms annually, just to kind of make sure that nothing's changing. Keep in mind, only 2 to 4 of the screening mammograms out of every 1,000 lead to a cancer diagnosis. Some women who have a genetic history, family history, or other factors may need to have MRIs or ultrasounds with their mammograms in addition to, and they need to discuss that with their physician. I believe mammograms can be a game changer. They do amazing things, and I'll tell you why. I have some personal experience here, and I'll tell you about it. I have a patient, we'll call her Sharon. Sharon's a 42-year-old stay-at-home mom. She has 4 young children. And she was telling me continuously how mammograms cause cancer, the radiation is bad for you, it just makes things worse. Until Sharon's mother was diagnosed with breast cancer, which was caught on a screening mammogram. So, with some gentle urging from her mother, I say gentle, Sharon was forced to have her first mammogram at age 42. Unfortunately, we did find a small, slow-growing cancer. This was on her first mammogram. And I think she would be the first to tell you this mammogram saved her life. She is one of many. Okay, are you guys convinced yet? Will you be getting your mammograms? Will you spread the word? Let's recap. I spoke about what mammograms are, why you should get one, the myths, facts, and excuses regarding why women forego their mammograms. And I shared a personal story about my friend Sharon. And there is good news. We're finding these cancers earlier through screening, education, medical and technical advances. Breast self-awareness includes knowing your risks, getting your mammograms, knowing what is healthy for you, and making those lifestyle choices. I hope this message will give you the tools to make an informed decision. We need to increase this awareness, and I hope you're empowered to take action and make more informed choices. Mammograms are important. Early detection is key. This is just the beginning, and this is a good thing because there's so many new things happening on the horizon. Have you had your mammogram? Spread the word. Give yourself a gift. It may not be shiny, sparkly, expensive, indulgent, or pink. But I do believe this will be the gift of a lifetime. October is the perfect month to schedule your mammogram. Thank you.